Hey everyone, this is our KIN 102 or Kinesiology 102 lecture, Introduction to Upper Body Muscles. We're not going to worry about the origins and insertion so much, like where all these muscles are attached specifically. We're just going to be looking a little bit more at some general terminology and the actions of the muscles. Okay, so let's start with origin and insertion. Okay, and some of these terms you'll see are kind of opposing terms, but origin and insertion. So the origin of the muscle is going to be the one that is typically fixed. It typically doesn't move, like it's not near a joint that's going to be moving while the muscle is acting. The insertion is at the point usually further away from the midline of the body that the muscle attaches to, and it moves something else on the other side of a joint. So, for instance, if you look at this muscle here, this is the biceps brachii that we're talking about, and that's the one right here that we make a muscle with in the upper arm. The origin of the biceps brachii is closer to the midline of the body. So the midline divides our body in half, basically from right and left halves, right down the sternum there. So the origin is closer to my torso here, or the midline of the body. It's fixed. It's not going to do a whole lot of movement up here. The insertion of the biceps brachii is just on the other side of my elbow joint, so it's distal, but this is the joint that biceps brachii typically moves, okay? So the insertion is closer to the point of movement during contraction, muscular contraction, okay? So origin closer to the midline, insertion a little bit further. Insertion is where the movement typically takes place a little bit more often. Then we've got our agonist and antagonist. And an agonist is basically the muscle that is working at that point. The antagonist is the muscle that is at rest while the agonist is working. So if we look again at that biceps, the antagonist for the biceps would be the triceps. Usually the agonist and antagonist are on opposite side or opposing sides of a bone or bony area. And so for here, we've got our prime mover, which is our bicep. It's going to flex or contract to move the elbow. While this is happening, our antagonist would be the one that opposes it. It's on the other side. And this one is going to be at rest. Now we could flip this around and make our triceps the agonist. And if that was the case, the flip side of that would be the biceps being the antagonist. That's not what we're doing here, but we could flip it around and that would work the same way. While this tricep is working, the biceps would be at rest. Then a synergist. A synergist is basically a muscle that helps other muscles work. So it helps the agonist or the prime mover to perform the movement. It's not the prime mover or the main mover itself. It's just a smaller muscle that's going to help a little bit. So a synergist here for the biceps brachii, we're going to use that as our example once again. Our synergist would be the brachioradialis, which is a muscle that comes from the forearm and attaches to our upper arm. And because of where it attached, it doesn't have a lot of strength. It doesn't have a lot of effect on this elbow joint, but it does help that biceps brachii a little bit in performing this contraction and flexion motion at the elbow. Okay, so that's a synergist. A synergist basically helps. And here at Synergy, we help each other learn a lot of things. So just remember that. Synergist is a helper. All right, and then lastly, in our terms and definitions here, we have range of motion. Range of motion is just the full movement potential of a joint. What is the range of motion? So we have a range of motion, again, at the elbow, if the bicep is working. So basically, my range is from right around here, and if I open that joint to about here, so to about 180 degrees. So this is probably, I don't know, maybe about 30 degrees to 180 degrees. That's my range of motion. That's the potential for my joint. So there are three types that this can fall under: active, passive, or resistant. And so if it is active range of motion, then I am going to use a muscle basically, and that's the one right in the middle. I am going to use my biceps to go through this range of motion. That's active. I'm actively going through a range of motion using a muscle or a group of muscles. Passively, I'm not actively doing it myself. Maybe I am with the other hand, or I might have a therapist that's moving my arm through this range of motion. So I am not using my bicep to do this now, this time, or any other muscle group. I'm allowing something else externally to passively move me. I'm just being a passive participant right now. Okay, so I'm not an active participant, which is me doing this. Now I'm a passive participant. Okay, and then resisted range of motion would be moving against an external force or resistance. So on your right hand side, that little picture, it shows someone with a weight that they're holding in their arm, and they're moving that weight, which is a resistance, against that range of motion basically. So that weight could be bringing my arm down through a range of motion. Okay, and I'm trying to move against that force or resistance, but that is increasing my range of motion. Okay. It could, on the other hand, also decrease it if someone is pushing on it a lot and I'm pushing against it. Those are some terms and definitions. Now let's look at the muscles themselves. Okay, so we're going to go through a lot of muscles here in just a second, but they're named or they're classified according to a lot of different things, really 7 different ways that they're classified. The first way that they're classified is by location. Okay, so I'll have how they're classified up in the left-hand corner, and then I'll say what that means basically. Okay, so the location. So the muscle's location of the body is attachment to a bone here. So for example, the frontalis muscle is located on the frontal bone of the skull. So they call it the frontalis. See the name frontal in here is on the frontal bone. So sometimes muscles are named according to their location of the body. And here on the frontal bone, it's called frontalis, frontalis. Then we have something, maybe it's named because of the size of it, how large it is or how small it is. So the muscle size compared to other muscles in the area. So for example, the gluteus maximus is larger than the medius and the minimus. So they call it maximus because it's the largest of the gluteal muscles in that area. Okay, so we had location already, where it's located, and size now is the second way. Third, we've got muscles according to their shapes. So sometimes a muscle has a specific shape that is like another shape that we already classify. So here are 2 examples. The deltoid muscle. Deltoid basically means, in correct terminology, deltoid means triangular. And so the deltoid muscle here is like an inverted triangle. Okay, so it's a little flatter on the top, it's got a point on the bottom, and this is actually 3 muscles that come together as one group, but it's shaped like a triangle. So it's shaped like a deltoid. And then here we have the rhomboids, and there are 2 rhomboid muscles. One's a little bit bigger on the bottom here, and one's a little smaller, layered right on top of it. That's the minor. But we have something shaped like a rhombus, if you remember that from geometry, I think it is. Yeah, and that's the rhomboid. So it can be classified by shape. Then we have the direction of the fibers. Okay, this is always the fibers, not the muscle itself, but just the fibers. So it's classified according to which direction the fibers generally take. So if we look at our rectus abdominis here, rectus means straight. Okay, rectus means straight. So if you ever see rectus anywhere else in a muscular name on the body, that means the muscle is straight. and that means like straight up and down or something like that. So, and then oblique basically means slanted. So we have our rectus abdominis, and then we have our obliques. You can kind of see some obliques. We have internal obliques and external obliques. External, obviously, meaning on the outside externally. Internal is just below them, but these are on a slant here. You can see the external obliques really well on the right-hand side. And the internal obliques have a different slant. So basically, they kind of crisscross over one another. Okay. And so you have rectus, straight, and you have oblique, slanted. So sometimes the muscles are named via their direction. Then we have the number of them. So we have biceps brachii and triceps brachii, just to bring it back to the biceps. Biceps, bi means two. Triceps, tri means three. So the biceps, anytime you see something that is biceps, so this is biceps brachii, there's also biceps femoris, that means there are two heads to that muscle. So two muscle bellies, and they're close to each other. Triceps brachii has three muscle bellies. So we have the long head, we have the medial head, and then we have the lateral head as well. Okay, the medial is kind of tucked behind there. You can't see that very well. Okay, and so there are three heads to the tricep brachii. So bi and tri, and you may see quad. So quadriceps, right in front of your legs there, that has four heads to it. And then maybe according to their action as well. So if you see something that says flex or extend, that means that that muscle flexes a joint or extends the joint. So for instance here, this action of the flexor carpi, this is the flexi carpi in the front of the arm. There's also extensor carpis on the back of the arm too that you'll see later. But the flexor extensi or flexor carpi radialis here flexes our wrist. So it brings my fingers closer to my forearm. My extensor carpi muscles would extend that wrist as well. So if you ever see flex, that means that it's bringing 2 points closer together. Extend means it's bringing that away. Okay. And then these can also be classified via their origin insertion. So what I mean by this is where these muscles are coming from, that will be in the actual name of the muscle. So this one has 3 different locations. This is our SCM, so it's a big muscle of the neck here. It says 3 muscles that it either comes from or attaches to. So it's the SCM, the sternocleidomastoid. And the sterno means it has a sternal head. So the sternum, which is right in the center, the breastbone, there is one of the heads that attaches to the sternum. Cleido means clavicle, basically. So one of the heads attaches to its clavicle, and you can kind of see down here the sternal head and then the clavicle head on the bottom right-hand corner. And then the mastoid. The mastoid process is this bump right in back of our ear. That's where this SCM or the sternocleidomastoid comes from. That's actually the origin. Okay, so origin and then 2 insertion points. And those 3 points are all in the name of that muscle. So if you see something that has the name of a muscle in it, or it has the name of a bony landmark in it, you know it's coming from that bony landmark. It's located in that area. So you may see that with naming the muscles as well. Okay. All right. So now let's go into the muscles themselves. So the names and actions. Remember, I told you you're not going to have to right now. We're going to go into all these muscles in a lot more detail later in the school year. But for right now, we're just going to go over the upper body muscles and the actions that they take because it's a lot easier than remembering origins and insertions. Okay, so let's start with, again, the sternocleidomastoid. This muscle, we have one here, which remember it attaches two places, but one here and one on the other side of our neck. And what it does is either neck flexion, so it flexes the neck forward. It also rotates the head one way or another. And usually it's, if this is active, then it rotates to the opposite side. Okay. And lateral flexion. That's lateral flexion. So if you remember some of these, we went through directions and basic movement terminology earlier. Now we're just putting all this terminology with locations as well. Okay, so sternocleidomastoid, or SCM, is what it's also called for short. That's the acronym. Is neck flexion, neck rotation, and lateral flexion. Okay, so as we're going through these two, just maybe palpate those on yourself, and as we're doing them, see if you can feel them activate while you're doing those motions. Okay. Then we have the pec major. This is the bigger chest muscle that we have on the outside. For women, part of that pec major is under the breast tissue as well, but a lot of it is still accessible for us as a massage therapist as well. Okay, so when I have on my intake forms that, if you want any pec work, check this, or if you don't want any pec work, check this. That just means I'm working on the upper aspect of the pecs, not necessarily the lower aspect of the pecs. Now, there is still a way to do that, and there's still a way to do that ethically as well, but we don't get into that. It's a little bit more advanced, okay? But I can access right along the sternum, and I can access the upper pecs really easily, okay? So for the pec major does shoulder flexion, okay? And so if we go shoulder flexion, I'm going to move this back here a little bit so you can see me. So shoulder flexion would be this, okay? So I'm flexing this up from the side. This is shoulder flexion, okay? Shoulder adduction, okay? So adduction would be, and this is really should be horizontal adduction. So arms are out, and I'm going to add them together this way. So both arms, if they're all the way out, are adding together. They're coming and adding together, okay? And also, this is adduction this way, okay? And then internal rotation. So internal rotation, basically, if you look at my hands a little bit now, so internal rotation is the whole arms, from the shoulder, my hands are going to rotate inward. So looking at the shoulders, you see my shoulders kind of come inward, okay? That would be internal rotation. Then keep moving. We have serratus anterior. Now these are, if we strum along the sides of the body, we kind of feel these finger-like projections, and they go down our ribs. And with a bodybuilder, a good one at least, you can really see these fingers kind of popping out on the side of their body. That is the serratus anterior. So with this does scapular protraction and upward rotation. So scapular protraction basically just means that my scaps are coming forward. So they're coming forward towards the anterior part of my body. So if I were to cross my arms over this way, let's say, my scapula would be moving forward on my rib cage. And so if you see where these muscles are going, their fixed attachment is right up here on the rib cage. The moving attachment is underneath this scapula and attached to like the medial border, but the front side of it. And so it's pulling the inner part of the scap this way, okay? So from the back to the front. And so that is scapular protraction as opposed to retraction. And upward rotation. So it is pulling on this this scap, and it is pulling more on the top of that scap, and so it's actually turning the scap and rotating that scapula. Okay, so that's upward rotation. It's a little easier to see that if you go to your trail guide to the body book and see that upward rotation. Okay, and explain that. Then we have our rectus abdominis. Okay, remember rectus means straight. And so there you can kind of see this is our abdominals go all the way up to like that xiphoid process and onto that sternum. And then they go all the way down to the pubic bone. Okay, so they're very long. Typically, what we're seeing when we look at someone's abs is this section right here. And this is around the belt line. So we typically don't see the abdominals below the belt line much at all. You know, some girls in really skimpy, like bikinis, sometimes you see a little bit more down here of their abdominals. But for guys, generally, you don't see much more than this, even in like Speedos or so. Okay. But this does trunk flexion. So we're flexing forward. And it simply just stabilizes everything because it's attached to the upper half of the body, the torso, and the lower half of the body down here. Okay, so it helps to stabilize things too, so they don't move too much. And then our obliques. Our obliques, remember, we have internal obliques, and then we have external obliques. Our internal ones are below the external ones, because the external are on the outside or externally located. And then the internal obliques, internally located, and they crisscross. Okay, and that helps them do different things. That helps them turn to different directions. So both of them do trunk rotation. So if I'm here, I'm going to rotate at the trunk, rotate at the torso here. And they do lateral flexion. So depending on which one is working, I either laterally flex to the right or laterally flex to the left. Okay. And then they also, when they work together at the same time, instead of one more than the other, they help to flex the trunk. And so they assist with that flexion that the rectus abdominis is doing. Okay, so again, trunk rotation, lateral flexion, and flexion. Back up to that biceps, the biceps brachii. This one, because of where it's located, and we kind of went through this already, but basically it is flexing the elbow. Okay, it flexes the elbow. And forearm supination. Now, supination is when we have a bent arm. Let's say a bent arm this way. Let's see if I can see where I am on this. So we have a bent, you can't even see me. Okay, so if I have a bent arm, this is supination. Okay, I'm basically holding a bowl of soup this way. Okay, so again, bent arm, my hand is down. I'm going to supinate the arm just like this. That's supination. Okay, and then flexion. This is flexion, just like this. Flexion. Okay. Now, triceps brachii. So the triceps brachii does elbow extension. So remember, the triceps is located on the back of the arm here. And so if it's doing this, then you see the bicep. The bicep is active. The tricep is nice and soft back here, and it's not doing much. Now I'm going to activate the triceps. The biceps gets softer. The triceps gets more firm. And so this is extension. It's bringing that arm from the back, bringing that arm into extension. Okay? So that is the triceps. And that's the only thing it does. This is extension. The deltoid. The deltoid does shoulder abduction, flexion, and extension. So shoulder abduction, maybe further away again. So shoulder abduction is bringing away. Remember, adduction is adding something to the body. Abduction is abducting or taking away from the body. So it does shoulder abduction. It does flexion as well. So this would be more horizontal flexion. Actually, here, sorry. We're going to go front of the arm here because there's 3 heads to the deltoid. Remember, you can kind of see anterior and posteriorly there. So flexion is going to bring that arm up. This is flexion, and that's more the anterior or the front part of the deltoid. And it also does, if we're looking at the back part, from this position, it's going to help extend the shoulder as well. Okay, so flexion, extension, and abduction. Okay. Now we're going to the wrist. I know that kind of looks like a leg there, but we're going to the wrist, flexors and extensors. Okay, and here you can kind of see they're a little bit fuzzy here, but the flexors on the left-hand side, you see the flexor carpi radialis muscle, the palmaris longus, and the flexor carpi ulnaris. Remember, it has the word flex in a couple of those, so you know it flexes. That's whenever someone says, well, what's the action of this muscle? And it says flex in it, you know it flexes. Okay, so this flexes the wrist, and the other one's extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris all extend. So the posterior view, that means they're on the back of the arm. Anterior view means they're on the front of the arm. And so if you look at those, again, flexion of the arm or flexion of the wrist. Let's see if you can get me in this picture here. Here we go. Flexion of the wrist. This is what the flexors do. Extensors extend the wrist. Okay, so flexors flex, extensors extend. Okay. The trapezius. Now I want people to see this full picture here of the trapezius, because what we think of when we think trapezius often is just the upper traps. This trapezius goes all the way down here to like T12, okay? All the way almost to the lumbar vertebrae is the length of this. So it goes all the way from the skull all the way down. Okay, so it's not just this meaty portion right here on top of the shoulder. Your traps are upper traps, mid traps, or middle traps, and then lower traps down below. Okay, so if you look at that, that's why you can kind of see, oh, these have a lot more actions than just hiking the shoulders up. Okay, so the first thing that it does is scapular elevation. So scapular elevation is basically just moving the scapula up. It's shifting the scapula up. So on the back of my shoulders here, the scap is moving up towards the top of my shoulder. It also does retraction. Okay, so the mid trap here, if this all tightens, it's going to pull the scap this way. So instead of elevating it, going up, like towards the skull, now it's going to be pulled inward towards the midline, towards the spine. That is retraction. So remember before that serratus anterior had a effect of pulling the scapula forward. That was protraction. Now we're going to go retraction of those shoulder blades. And remember, the retraction brings things back towards the midline. And then it also does rotation. So this here, if I am pulling with the lower traps here, it's pulling on this part. And so it's basically going to turn the scaps up on this part. So this is going to go up and this is going to go down. So it's going to rotate the scaps this way a little bit. Okay? And again, we'll go into this in more detail when we go into each specific muscle. Okay? And then our posterior rotator cuff muscles. Okay, so if we look at these, the one that we're concerned about right now is the infraspinatus. There are 4 rotator cuff muscles. The infraspinatus is the one that we're looking at. This is the bigger one, and infra means below, supra means above. So the infraspinatus is infra or below the spinae or the spine of the scapula. This is the scapula. So it's right on the back, that big backbone there. Infra means below the spine of the scapula. So it's infraspinatus. Okay, it's a bigger one of the rotator cuff muscles. So this one does shoulder external rotation. So because of where it's attached on the bone on the outer aspect, when this shortens, it's going to bring this shoulder back. So shoulder external rotation is going to be, shoulder external rotation is going to be external rotation this way. Okay, so if my thumb is normally forward, I'm going to externally or bring my thumb outward and around. That's what the infraspinatus is going to do. Okay, in addition to just basically keeping that shoulder stabilized, because we have muscles on the front and the back of this bone here that stabilize the shoulder. Okay, so that's shoulder external rotation for the infraspinatus. Then if we go down to the lats are big back muscles, okay? So everybody thinks, oh, the lats are the back muscles, so they only do stuff on the back of the body. But if you look, they start right around T7, so halfway down the rib cage, and then they attach all the way down to like the sacral area and this whole iliac crest. So that's the hip bone. And then they go up and they go underneath the arm and attach to the front of the humerus. So the front of this bone here. And so because they attach to the front and they come from back here, they're going to internally rotate that arm. Okay, they're going to pull this way and it's going to twist that arm inwardly when that happens, or twist that bone. Okay, so again, shoulder, what it does at the shoulder, we have shoulder extension. Okay, and shoulder extension is if the arm is up here, it brings the arm backward this way. So if you think about latissimus dorsi or lat pull downs, we're going to be bringing that arm back this way for a lat pull down. So it's extending the shoulder. It's also it's also adducting the shoulder, so it brings the shoulder this way as well, and it does internal rotation of the shoulder as well. Okay, internal rotation. So it does this extension, it does this adduction, and it does this internal rotation. Teres major, okay? So teres major and teres minor, they're right next to each other. One's a little bit bigger than the other. That's why they call them the teres major and teres minor, because of the size of them. However, they both do very different things, okay? So the teres major is this one, if you looked at it only by itself. And here you see it along with some of the rotator cuff muscles. The minor is above the major. The major scoots underneath and in front of the humerus. The minor is in back of the humerus. So the major does an internal rotation because it pulls on the front of this bone and pulls the bone into a rotation inwardly, whereas the minor would pull the bone from the back and rotate the opposite direction. So teres major is the one that we're doing here. And with teres major, it has a few different things. So it does shoulder extension. It also does adduction. Okay. Both of the major and minor do both of these things, the same thing. The one thing they're different is the internal rotation now, okay? Whereas the minor did external, major does internal rotation, okay? Internal rotation. At the shoulder, internal. So now you see my elbow goes backward the other way. Internal rotation. Okay. And here's that teres minor. We just kind of flipped those. So we started with the major. Now we're talking about the minor. And the minor, again, does shoulder external rotation because it's attached to the back of the shoulder here. So it's going to be pulling on this little knob closer to the scapula. And so the only thing it can do, because this rotates, it rotates it backward. Okay, so it externally rotates. So again, it's an external rotation. So it is external rotation. That is the teres minor. It does external rotation. Okay. Oh, awesome. So that was our last slide. So those are muscles of the upper body. Again, we are just more concerned about the motion or the action of those muscles right now versus exactly where they're located. But once you look and you see, okay, this is where it's located, just like we saw with the teres major and teres minor at the end there, because of where they're located, because of where they're attached, even though they may be close together, they may do different or opposing type actions because one may be attached here and pulling things in, one's attached to the back and pulling this way and pulling it outward. And so those are the muscles, those are the actions. We'll do lower body ones later too. And again, we'll get into a lot more detail when we really delve into individual muscles. Okay. Hope that was clear enough for you. And we'll try to do a check-in later and talk about these muscles a little bit more as well in those actions too. As always, if you have any questions, send me a text or an email, and I'll get back to you as soon as I can. All right. Thanks so much, guys. Bye.